hat, mask, goggles, all that kind of stuff. First thing I'm gonna do, open my gown glove set, which is right over there next to you, okay? Normally, either us or the circulator who's working with us will open up our back table pack. Very simple to open. This is what it looks like when it comes open. When it's closed, it's got the dust cover on it. It's got a wrapper. It says push here. You open up one way, you open the other, you pull towards the sides. This will be open for you already for Module 2 or for your Module 3. And most likely when you're in the hospital, you'll get experience opening packs. So I'm not going to have you worry about it now. Extra things that we need to look for on it. Pair of surgeon's gloves, okay, which I have on the front here. I have my suture open and I have my blades open, okay? So I'm looking at that stuff. I also want to make sure I have all my basic equipment. I have a Mayo stand, a back table, and a ring stand, okay? This is our instrument set. This is called a Genesis tray, okay? This opens up. The outside is completely contaminated, obviously, because we touch it. There's an inside basket that's the sterile part. You will also see the blue wrapped packs of instrumentation. I will show you how to do that. It's very similar to this. I just have to make sure that I have them all organized and everything, okay? So to open this, we flip the sides up like that. We're gonna lift it up and away. Inside here, you have to take these blue filters out, okay? The brown dot on this one indicates that it's gone through the sterilization process. The other thing you have to do, hold it up to the light and you're checking for any holes or to see if it's wet. If it's wet, it means that the drying process did not complete. Inside is considered contaminated, okay? If there's a hole, it means that something tried to go through this and contaminated the inside of it, so you would not use your instruments, okay? So this is your first indicator. When you guys come in for evaluation, it is going to be open and presumed good to use, okay? Before we scrub, and right after we open our instruments, we just want to take a quick look inside of our instrument tray. Now, I can't reach over because unsterile is sterile, right? But I can visualize it has an indicator on the inside, and I can't touch it yet because I'm not sterile, but I can see that it's in there. If we couldn't see an indicator anywhere, we wouldn't use the tray either, okay? Next, I would go outside of my OR, go scrub. I'm just gonna simulate this. 5-minute scrub done. Come back into my OR. I'm gonna gown glove. Now notice, I don't know how I'm gonna have this room set up yet, but wherever my stuff is, my back will never be towards any of my sterile fields, okay? You just Velcro the top for me. Even as I'm standing here, out of my periphery, I can still see my table, okay? So my back is never to my sterile field.
Okay.
Thanks, that's good. Did it come undone?
Yep,
That's
it's
fine.
stapled in there.
Notice how I'm confident in my movements. I'm not second guessing which way it goes. I'm getting them on. Yes, I've had 14 years of experience, but you should be this way too. Okay. Spin. Thank you. All right, and now I'm going to walk over to my sterile field. This is where you have a little bit of free play. Hold on, don't look. My goggles won't stay in place. Okay, didn't happen. Edit that out. All right, so my back table. I can touch all of this because I'm now sterile to sterile. I need to do two things, and this is where you kind of have room to make adjustments on how you think. I need to put my instruments over here, and I have two surfaces that I have to drape, okay? You can move the instruments, then drape. You can drape, then move instruments, whatever you want to do. I like to just get my mayo stand out of the way, okay? This blue plastic is your mayo stand cover. It says on there, mayo stand cover. It says right and left. Your hands are gonna go on each one of those sides. You're always gonna orientate it and open it over your back table so that if it falls or you do it over here, you don't contaminate it, okay? Left hand on one side, right hand on the other side. Nice big opening here, okay? This opening has to go around the mayo stand. My foot automatically goes on to secure this, okay? So it doesn't move all around. One hand is going to feed it on, the other hand is going to open this up and not let it fall. Okay, we push it all the way out to the edge. Next thing, this is only waterproofed, okay? We want to add a protective layer because we are using knives and sharp things. So I'm going to put on 2 towels. The smaller mayo stands, I'm using the larger one. The smaller ones, you'll only need 1 towel for, okay? Now because it's on wheels, we can move it so I don't ever put my back towards my table. We're going to reach across, we're going to lift up one side, and we're going to tuck this all in. The tops of these lift off. So if you look at the mayo stand back there, you can see what the heck I'm lifting up. Nope, top tray. Yeah, you can move that. Yeah.
Oh, okay.
That's what I'm lifting up on here, okay? And getting tucked under. It's getting tucked under for 2 reasons. One, it's nice and tight, so if we grab a towel or the mayo stand, all of our stuff isn't going to go flying. Secondly, we can't see underneath our mayo stand, right? So it's considered contaminated. We're going to put this over the patient's feet, and we want to be able to see their toes and make sure it's not resting on their toes doing damage, okay? So with it nice and tight, we know how much room we have. Next, I'm going to take my pack, and I'm just going to shift it a little bit. I am working on a very small table. Challenge yourself. Become organized on a small table, because as you get to a bigger table, it's just going to be easier because you have more room, okay? But practice on both. I'm going to put my instruments always on my right-hand side. Now I'm going to go in, and I'm going to look for that indicator. I see my indicator, but it's a little hard for me to tell what it says. So I can go in, reaching with just my glove, and I pull it out. On here, this one says pass fail. The black line is just into the pass part, or the green, into the green part for the pass. That means that my instruments have been sterilized. If it was not in there, and it did not pass, I would be contaminated, and my gloves would be contaminated, and the tray would be contaminated. We take the tray away, ask the circulator to take our gloves off for us, get a new pair of gloves, an open glove, okay? Our gown can stay on because we didn't touch anything to our gown, just our gloves. Also, you may have to touch it if the indicator is flipped upside down. You'll see that too. So outside of this tray is contaminated, so I can only touch the inside basket. I'm gonna reach, grab these 2 handles, lift straight up, okay? And I am gonna sit here and I'm gonna hold this with just my hands, not my body, not my gown. Reason is, those filters that we looked at top are on the bottom too. You have to stand here and wait for the nurse to say that it's all clear, okay? If it's not all clear, then your gloves are contaminated, do the same thing. Have them take them off of you, open a new pair, and you would open glove yourself, okay? But we're gonna say it's all clear, so we can set it down on our table. Nurse then would take this away. Who's my nurse? Anyone? Anyone? Somebody take it away. Perfect, you can just set it wherever. Now, I have to drape my ring stand. I'm gonna drape my ring stand with a half sheet, okay? I open up my half sheet all the way to the middle. I step on side of it with my back away from my sterile field. I'm gonna open it all the way up to the middle, let it fall. Notice I'm not gonna drop my hands below table level, okay? Stabilize it with one hand, pick one up, pull it towards me up high, let it fall. Same thing, cuff my hand so it's protected from non-sterile areas, let it fall. Now, my big basin fits in there nice and well. From here, once you have things draped, it's kind of up to you how you want to organize. Excuse me, I have the hiccups now. Best rule of thumb, touch it once, put it where it goes. If you're moving from things from here to here to here to here just for it to end up over here in an emergency setting, you're killing the patient because you're wasting time. Okay? This comes with practice. The more that you practice, the easier it gets because you know where to put things. If you look at the picture up there, that is just one example of how you can set up your back table, and that is the small table. I set it up pretty similar. I don't take all of my stuff out. I use all of my stuff. But I put the roll out. I put my basins on my upper left-hand corner always, and I always put my sharps on my lower left-hand corner. That's kind of a industry standard that you'll see. So first things first, I'm going to take my stick towels. I'm going to put them in the back of my pack. I'm going to take off my 2 surgeon's gowns. I'm going to give them a glove. I'm going to take their gloves. I'm going to stick it on top. Switch it out with my basins here. Put that there. Now, I can fold up half of my patient drape, because I have a small table, and place my basins down like this. Okay? Take them out, separate them. Accessory box, I can separate in a minute. I'm going to put that right there. All of my sponges I'm going to put in my kidney basin. My suction tubing, I do not count this, but I know I have to throw it off to start my case. I'm going to put it right up on my Mayo stand. Skin staples, I'm just going to put on my back table out of the way because I'm not going to need those to the very end. Last thing in here is my suction tip. I'm going to put this right next to my instruments because I know I have to count it. At this point, I can fold my patient drape in half, make it even smaller. And I'm going to make 4 wound towels. These are what we are going to use with our towel clips, our back house towel clips, right? I talked about how those are used underneath the patient drape. Well, this is what they're holding. When we drape, we're going to prep the abdomen, we're going to drape the wound with the towels, and then we're going to drape the patient to make it all sterile. This is just another extra protective layer, okay? To do these, unfold it the whole way, and I'm going to make 3 with flaps towards me, like this. And 1 with a flap facing away from me. When we talk about patient draping and I show you those videos, that will make sense why they're folded this way. From here, you're just going to fold it in half. Take your gowns, place them right on top, move all this over here. This is now set up in order of use from when the surgeon comes in from scrubbing to getting the patient draped, okay? I also have a nice clean working space now. I'm going to finish organizing this. My septum I'm just going to put in my basin. My chloroprep I'm just going to put over there. My Bovie I have to count, so I'm going to set that up here. My sharps box always goes in my lower left hand corner, and I'll put my sutures right in it. Cottonoids, those have to be counted. A ruler, I just put this right underneath my sharps box like that because sometimes we have to count things. Labels for any medications or fluids on my back table. I'm going to put that with my marking pen. These are called hypodermic needles, like the needles that you get shots with, give injections with. That's what those are called. I'm going to put those in my sharps box too because we have to count those. Syringes, these do not get counted. Just be aware of how many you have. They don't technically go into the patient. They never leave your hand. Peanuts and tonsils, okay? Now I have an extra container. I'm just going to go ahead and throw my towels in there. My working space is nice and clean and organized. I didn't shift things around too many times, right? From here, I'm going to take a towel and I'm going to make a roll. This is going to hold my instruments. All you're doing is rolling your towel so it's nice and tight. The tighter it is, the more that your instruments will stay up, okay? I'm going to grab my first stringer of instruments, which is this one here. This one has my needle drivers on it. I'm going to put my needle drivers closest to my sharps box, okay? Take off my towel clips that are holding it together. This is a very old school practice. Systems have changed. this is just what we have, okay? Grab my next set. Make sure that all the tips then are following the same direction. It should go from large to small. All right, things to know about your instruments. They should all come unclamped, minus the ones that are holding them in place, because that's how you know the sterilization process was complete. If they are clamped, you can't guarantee that it got inside of those jaws, right? Also, I want to make sure that everything is in order. Students will be putting this away. I will try to make sure that they are put away correctly. But if something's out of order, you just want to make sure that you put it back in order before you start counting. Next, I'm going to organize this. Now, according to the picture, Gemma had taken everything out and laid it on her table. You can do that if you want. My tray's here. I'm going to use my tray to my advantage, okay? This is exactly what I do at work, too. Take out all of my knife handles, put them over here. I'm going to take my forceps and group them together by teeth and no teeth. That way, if they need something quickly, I know right where it is. There's no second guessing what's where and who's what and all that. Right there. And then I'm going to organize my retractors. If I have more than one of something, I'm going to group them together. I'm just going to look and make sure that I have everything organized, and now I'm ready to count. Counting, super important. We are going to count in a specific order. Sharps, sponges, and then instruments, okay? When we're intraoperative, we're always going to start counting from the patient to the Mayo stand to the back table. It's kind of a full loop, and every time we start counting something new, we're always going to do that same loop. Same with here. If we had things that were countable up here, we would start here, then go to your back table. You guys are learning. Leave anything that you count on the back, because if you don't, guarantee you will forget to count it, okay? Okay, so starting with my sharps, things that fall under sharps. Blades, 1, 2. I don't care what blades they are, we always count them as a group. Hypos, 1, 2. My suture needles are my atraumatic needles. Now, a quick little suture lesson. Sutures can have a single suture in it or multiple packs. And I'm not talking about the strands, I'm talking about the needles. So you can see in the difference of these by the picture. This one has 1 here, but it says an 8 count. This one shows 2 needles, this one shows 1. Okay? We always open them up to make sure that what we have on the outside matches what we have on the inside. This one says 2, it's got 2 needles. This one says 1, it's got 1 needle. Not gonna open up this one, but we would open it up and we would see 8 needles, okay? So sutures are hypodermic needle or atraumatic needles. 1, 2, 3. We count them together, okay? Because when we put them in here to organize them and count them when we're done using them, that string's not going to be attached, so we don't care what kind of material it is. We just care that the needle is there. The last thing that we count with our sharps, pull it out, always our Bovie tip. If we had a scratch pad, we could count a scratch pad with it too, okay? When I'm done with this, instead of placing this down here, it's already counted, so I can put it right up there, okay? Next thing, sponges. This is to show you how sponges come. They always come with a paper wrapping on it. We have rubber bands because we reuse ours. We never break that paper seal until we are counting. Because if one falls and we don't know it, and we count and it's uneven, but then all of a sudden we have more, on an incorrect count, we have to count again. Do an x-ray, okay? So never break that seal until you're ready to count. Laps. 1, 2, 3, 4, 5. I'm always separating them so me and whoever is counting with me can see how many there are. I'm also looking for those X-ray detectable parts, making sure nothing's stuck in between, okay? When I'm done, I'm gonna put those back. 4x4s. 1, 2, 3, 4, 5, 6, 7, 8, 9. Crap, there's only 9. What do we do? Where?
Yeah.
Wait, so you don't keep them?
No.
We don't keep them. Where do we throw them out?
They're like a red waste bin or something.
And where do we take that?
Out of the room.
Out of the OR. Very important. So I left this one in here on purpose to show you.
Wait, mid count, you'll just toss them?
Yes, because we can't have an uneven number, right?
See.
We have to have a 5 or a 10. So if there's 9, we're going to take them out, consider them contaminated, out of the room, don't even include them in your count, okay? All right, next, peanuts, 1, 2, 3, 4, 5. Tonsils, 1, 2, 3, 4, 5. Capnoids, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If ever you get stuck on one, just recount them. Nobody's going to yell at you for counting them to make sure that they're there again. Also notice, I'm not just a loud person. I want to make sure that the person that I'm counting with can hear me and see them, okay? So that's it for my sponges, right? Doing a quick little scan to make sure I have no more sponges anywhere. Lastly, instruments. Instruments are only counted when we go inside of the body cavity, where we go deep, okay? So we're doing a laparotomy. So of course we're going deep. We're opening up that abdomen. So we are going to count our instruments. First things, left to right. This way you never miss anything. I'm going to say the name of the instrument first, and then I'm going to count individually just like I did. 1, 2, 3, 4, 5. Even if I can see that I have 1 or 2, I'm still going to call that number out, okay? The other important thing when counting instruments, which is really hard to do when you're first learning, is to show the tips to your circulator. They have to be able to see what you're counting too, to make sure you're counting the right thing. If you struggle, like, I'm going to make this look easy. I've done this for 14 years. I'm going to move it so that you can see it. You can use the end of a knife handle as long as there's no knife on it or no blade on it, and move the ends of them, okay? We'll work together to perfect your counting. All right, knife handles, 1, 2, 3, 4. Scissors, 1, 2, 3. I'm grouping them together. I don't care which ones they are, they're grouped together. Needle holders, 1, 2, 3. Gallbladder, 1. Long Rochester, 1, 2, 3, 4. Tonsils, 1, 2. Coker, 1, 2. Babcock, 1, 2, 3, 4. Alice, 1, 2, 3, 4. I can feel myself starting to get sloppy, so I can stop, organize, go back at it. Rochester, 1, 2, 3, 4, 5, 6. Hemostat, 1, 2, 3, 4, 5, 6. Straight hemostat, 1, 2, 3, 4, 5, 6. Straight mosquito, that's a new one for you. 1, 2, 3. Mosquitoes, 1, 2, 3, 4, 5, 6. 1 suction tip or 1 yank hour, doesn't matter, because you only have 1 here. Sponge sticks, 1, 2, 3, 4. Towel hooks, 1, 2, 3, 4. Forceps grouped together, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Retractors, up to your hospital, whether you're going to count them all together or individually. Lab purposes, I want you to count them individually so I know you know what you're counting. Devers, 1, 2. 1 Rue, 1 Malleable. 1, 2 Army Navies. 1 Richardson, 1 Eastman, 1 Sen, 1, 2 Rakes. Just do a quick look over to make sure you didn't forget anything. That is counting, okay? That's probably the most intimidating part because you really have to know your instruments. From here, we're going to set up our Mayo stand. I'm going to grab a needle holder. And I'm going to load my blades. The first time you load blades, ooh, blade went flying. What do?
Toss it out.
Who tosses it out?
Circulator.
Yes, she's going to use a piece of tape, not her fingers, to pick it up, and she'll put it in the sharp spots, okay? So for right now, I'm just going to load the 1 blade, but we're always going to load 2. Skin blade, inside blade, okay? We're going to pick it up, we're going to orientate it, and like I said, the first time we do this, we'll do it together, like the movie Ghost, so you can see how it feels. We're going to take our knife handle, and we're going to load it, okay? I'm gonna pretend like that other blade is on here. We always start on the arm side of the Mayo stand. The arm side being the side that connects the top to the bottom, okay? We're always gonna face our blades inward so that when we are standing next to it, we don't get cut. We always like to say this saying too: knife, fork, spoon. Knives, forks, we're gonna put up a tissue forceps and a thumb forceps. Tissue and a thumb. Spoon is our scissors just because they start with S's, okay? These go in a specific order though. Curved Mayo, Metzenbaum, straight Mayo. Curved Mayo and tissue forceps, heavy tissue. We have to cut heavy tissue to get to delicate tissue, where we use the thumb forceps and the Metzenbaum. In order to suture tissue, we have to cut tissue, okay? So that's why it's in that order. From there, we're gonna do 3 hemostats, 3 Rochesters, so you're clamping and occluding, okay? Then I like to do, or we're gonna do what I like to call A, B, C, and we only need 2 of each of these. 2 Alice, 2 Babcock, and 2 Choice. Now I just happen to have 2 cokers that are the same height on here, so I'm gonna put 2 cokers up there. That is that row. Alternating the handles will help immensely when you're using the little one, okay? The other thing that I need up here are some retractors. So I'm gonna take an Army Navy and a Parker. Set those up there. I need 2 lap sponges, 1 for the surgeon, 1 for the assistant. And I'm gonna connect my suction tip. That just goes in the end of the suction like this, and you wanna make sure that it does not fall off of your table, okay? Oh, we're missing light handles too. Probably up there. Gotta get light handles. From here, you really only have 3 things left to do. Load and unload a suture. You're gonna load it for a right hand and a left hand, which I'll show you when we do it together with the blades. Gown and glove a surgeon. You know how to gown and glove yourself. You're gonna open it up the opposite way, hold it for them. Super easy to do. And then you have to make sponge sticks. 2 sponges. You fold it in half a little bit, half again, and then half. That did not do it justice, right? So 1, 2, 3. And you will place these on top of the towels, but underneath the gown. Surgeon comes in, you're gonna dry them, gown them, glove them. He'll prep, drape the wound, drape the patient. So this is all set in order of use. From here, once you do your blades, take them off, take your needles off. I'll say, all right, your case is done. You'll take off your gown, break it off like you're at the end of module 1. And that's how you're gonna do module 1 through 3. Okay? Questions?